TB or not TB? Since the beginning of 2021, doctors and public health officials in the state of Washington may have been asking this type of question much more often. And that not be good. The state had 199 reported cases of TB, which is short for tuberculosis, in 2021 and has already had 70 reported cases just 4 months into 2022. In fact, according to a Washington State Department of Health announcement on April 28, the state has been having its largest TB outbreak in the last 20 years. Last year's TB total represented a 22% jump from the year prior. Reported TB cases had actually decreased in 2020 compared to 2019. However, before you say, "Yay, 2020", keep in mind that 2020 was when a little thing called the COVID-19 pandemic had gotten started. This meant that many TB prevention services and clinics may have been closed or understaffed. Plus, many folks may have avoided healthcare settings. As a result, those infected with the TB-causing bacterium Mycobacterium tuberculosis may have gone undiagnosed and thus have spread the bacteria without even knowing it. That, in turn, could have pushed the number of new cases up and up, in the words of Coldplay. The announcement quoted Washington's Chief Science Officer Sheng Kwan-Gett, MD, mile per hour, as saying, "It's been 20 years since we saw a cluster of TB cases like this. The pandemic has likely contributed to the rise in cases and the outbreak in at least one correctional facility." Also included in the announcement was a statement from Washington State Department of Corrections, DOC, Chief Medical Officer MaryAnn Curl, MD, testing of staff, and our incarcerated PO. Will continue to communicate with staff, their incarcerated population and their families as appropriate. One key will be to not err on the side of Mycobacterium tuberculosis. You can catch the bacteria by inhaling air contaminated by an infectious person who is coughing or sneezing. TB is not as contagious as the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. So prolonged close contact is typically required for transmission to occur. Nevertheless, someone with active TB needs to stay isolated, and people should wear N95 face masks when in the same room as the person. TB most often becomes a lung story with the bacteria wreaking havoc in your lungs. However, Mycobacterium tuberculosis can also go to and damage other parts of your body such as your kidneys, spine, and brain. Usually, it takes about 3 to 9 weeks from the initial infection to the appearance of a lesion in the lung or a person's TB scan test to turn positive.